Good afternoon, everyone. First of all, I'd like to thank the Action Pre-eclampsia and Marcus Green for all their efforts to support our patients, the healthcare professionals, and the researchers, and for including me at the meeting today. And also, many congratulations for a very successful event and a great program. Today, I'm going to talk to you about the Women's Health Research Priorities, which was a project led by the Royal College of Obstetricians and Gynecologists. And I'm representing a big team today, and I would like to take this opportunity to thank all of those who contributed to this project, in particular, obviously, the RCG staff and the fellows, our collaborators, and members of the steering group. The results of this project, or the Women's Health Research Priorities in the UK, were published in the Lancet yesterday. Women's health has been under-researched, underfunded, and undervalued, which contributes to the gender health gap. The research in women's health has historically been underfunded, which led to quite significant gaps in our understanding of prevention, diagnosis, and treatment of conditions that are specific to women. If you look at the data, you find that less than 1% of the global health research funding is allocated to women's health conditions beyond cancer. The data is quite striking, but I don't want to really dwell on the data in this talk because I really want to share with you the findings of the Women's Health Research Priorities. But it's clear from this data that women's specific conditions are relatively underfunded compared to the disease burden. So the aim of this project was to identify the most pressing unanswered research questions, ensuring that the research agenda reflects the priorities of patients, the healthcare professionals, and the societies, not mainly driven by the researchers or by healthcare professionals. An important role of the RCOG is the advocacy role. And what we are hoping that these priorities would guide the research funders, policymakers, and the researchers to focus on this evidence-based, equity-focused work aligned with the UK Women's Health Strategy, which spans across this life course approach. And over the last 12 months, we've been engaging with the major funders in the UK, so like NHR, the Welcome MRC, Wellbeing of Women, to inform them about this project, engage with them, and ensure that there is commitment that these research priorities would fit into their commissioning agenda and ensure that women's health is prioritized. So what we did, we followed a modified Delphi process with the UK public. So we decided that this is going to be focusing on UK. We did 3 online survey rounds and 1 workshop. And certainly we adapted the GLA or the James Linda Alliance methods for developing PSP or priority setting partnership. The project started officially in November 2024, but there was obviously a lot of work before that, since the beginning of 2024, in terms of the proposal, securing funding, also approaching the James Linda Alliance to work together. And we completed this project in November 2025. As I mentioned earlier, the results were published in the Lancet yesterday, and the official RCG report is due to be published beginning of December. And as part of this project, we reviewed all the existing priority setting partnership that's related to women's health. And we had 22 that's already published and 6 is still in progress. And we wanted to ensure that there is no, that the fact that we're not necessarily beating the process or we're not necessarily undermining the results, but we wanted to ensure that they complement them and allow them this condition-specific insights to sit within a broader context. So, and this is all included in the report. As I mentioned earlier, we had 3 rounds an online workshop. The first round focused on question generation, so that we had open questions, inviting people to suggest questions or topics. The second round focused on prioritizing the topics. The third, we're focusing on prioritizing the research questions. And we, in a workshop, we reviewed all these results and we reached consensus about the top 24 research questions across 12 themes and the top 10 research priorities related to women's health in the UK. We had overall more than 2,000 participants in this project. In the first round, we had more than 1,400 participants proposing nearly 4,300 research questions and topics. We went through the developing or thematic analysis. So we developed 35 themes under 6 topic headings. And through this topic, we went to the topic prioritization, which was the second round. So from the 14 themes prioritized, we went to the second round with the research questions, 130 research questions, 57 prioritized, and went through the process of actually going through them individually, looking in the literature to see whether they've already been addressed or there is already ongoing large study to address them, or there's already large grant from the NHR supporting a study to address them, or research recommendation, NICE guideline, or Cochrane review. And we took 49 prioritized and unanswered research questions with a workshop. We identified 24 research questions on the 12 themes, and then we managed to reach consensus on the top 10 research priorities. The project was overseen by a steering group and ensured that the membership has diversity, but also representation from multidisciplinaries. So it's not just obstetrician gynecologists, but also midwifery, sonography, innovators, psychologists, and also very importantly, representative of the public. And I'm really grateful to Jane Plump, who is the chair of the RCG Women's Voices, for her input, criticism, contribution to the work that we do. This is a list of the top 10 women's health research priorities in the UK. And I just would like to point out that the fact that it's actually emphasizes structural and systemic issues alongside clinical conditions. So not just typical conditions that you see the list of the contents of your textbook. There was also systemic and structural issues. So just to highlight a couple of them. So if you see here, the issues about the drug trials and the clinical studies and ensuring that there is adequate representation, obviously, of both sexes, so ensure that the results are also relevant and applicable to women as well as men. Also ensuring that the understanding how the hormonal cycles affect the drug metabolism and the implications of that. Echoing the current concerns in UK, certainly one of the research priorities about the reasons for widespread dissatisfaction with obstetric and gynecological care and what action co-professional both bodies take to address this. And then there we're also focusing on clinical conditions, including gynecological and breast cancer and effective treatment for targeted molecular and hormonal therapies, and how this treatment can be personalized to maximize benefit and avoid unnecessary toxicity. There were 2 research priorities related to endometriosis, and also research priorities related to menopause and also the menstrual cycles, but also related to pregnancy in terms of the postpartum period and the long-term impact of the postnatal health, including pelvic floor incontinence, sexual dysfunction, and also not just the physical health, but also the mental health and why conditions are underdiagnosed, in particular postpartum depression and anxiety. So just to re-emphasize that actually this top 10 women's health research priorities really, number 1, life course approach, but also addressing structural and systemic issues alongside clinical conditions. I mentioned earlier that we had the top 24 and then we got the top 10 research priorities. The top 24 again include under 12 themes that you can see them in blue. And again, just really highlighting they have this spans life course approach from the puberty and fertility to pregnancy-related conditions, also going into the menopause, and also reflect the multi-dimensional nature of women's health. So menstrual cycle, postnatal care, intrapartum care, stillbirth, preterm birth, and something that's very relevant to this audience is hypertension in pregnancy. And the two specific research questions were about the best ways to predict, screen, and promptly diagnose pregnant hypertension, preeclampsia, prevent short-term complications such as stillbirth, fetal growth restriction, and progression to severe disease, and also which treatments are most effective to prevent early onset preeclampsia. Just to emphasize, there's one theme, which is the inequalities and women's health services, which I've also alluded to in the top 10 research priorities. And as I mentioned, just to emphasize again, it is span across the life course from fertility and puberty to across to menopause and women's health conditions. Before I finish, just to address the issue about inequalities. We received many research questions related to inequalities. We know that women who are socioeconomically disadvantaged or from ethnic minorities or living in the more deprived areas in the UK, they tend to have worse outcomes. They have less access in many cases, and certainly that overlap with the research gaps because you have less evidence on how conditions present in women from different ethnic backgrounds. But also we were cognizant of the fact that the NIHR have issued a funding call for addressing the inequality challenges, and therefore there will be a large number of projects funded and supported to address these research questions. So really to summarize and share with you the key messages, I think in this project there was true partnership with the public. We had over 2,000 participants. We ensured that these research priorities are driven by the public, but also engaged with healthcare professionals and researchers. As I shared with you, there is certainly this top 10 or 24 research priorities addresses both medical condition, but also issues related to inequalities and to the healthcare provision. And certainly really call for fundamental improvement in research and care and better patient care and patient satisfaction. The life course approach, you can see the span across from the menstrual health to menopause, addressing also long-term health, not just the physical, but also the mental health, and call to action. And really, call to action is very important. What our target stakeholders for the research funders, we want to ensure that we have dedicated funding goals to address these priorities, similar to the existing goals for James Lind Alliance priority setting partnership. For policymakers, ensuring that these research priorities provide a timely framework for the refreshed women's health strategy that we heard about earlier. For the researchers, to advocate for designing studies to address these research priorities and ensuring that, of course, that there's a co-production and ensuring that we include underserved groups. So just to finish, really would like to thank the project partners for their support. And this is executive summary. This is going to be included in the report that's due to be published at the beginning of December. Thank you very much for your attention, and happy to take any questions.